Hi, I'm Sara McMannus, and I'm a critical care nurse, and I'm very happy to work with GE Healthcare and be here in India meeting with the critical care nurses here at Columbia Asia Hospitals. It's been a wonderful days that we've been meeting and training. All of the nurses are so excited about the new learnings that they're going to have to take back to their practice. We're using the Essentials of Critical Care education from the AACN, American Association of Critical Care Nurses, as our foundation for the program.
We are talking about using a robot for training. We are talking about using facilitators outside India to come and do training and also support us remotely. You really have to put it in a broader context of where we started and where we are today.
Well, critical care is one of the several areas in the hospital where the care of the patient is highly dependent on the skill and knowledge of the people who provide it. And if you look at all healthcare providers in a critical care unit, I think the function and the efficiency of the nurses would be high up on the list. It's also fair to say that currently and in India, the level of knowledge and skills of nurses in critical care needs improvement.
Well, I think the requirement is huge. I think the premise with which it was started was that there is a huge requirement. There's a major deficit in terms of both doctors as well as medical staff.
Now, our call was easy. Either we could be an opportunistic player in this segment and focus on what makes us better, or we can look at something that makes the healthcare system as a whole better.
Through this training, I came to know that what will be our first priority if such cases happens in our ward, or what we have to do.
So we all are very thankful to GE and Columbia Asia for giving this opportunity for us.
If I have to personally look at what the metrics of success would be for us, if we can take this and leverage the technology and take this initiative across to the remotest hospitals, across to the last caregiver in a country, in an emerging country, and we can train them to handle patients effectively and deliver the high quality of patient care that we are used to in US or a corporate hospital like this in India, I think that's where the win for this initiative lies.